Welcome to the Donna Sebo Show Special Editions. This program is dedicated to featuring authors and experts from around the world who will share their knowledge and insight with you, the viewing and listening audience. Literacy and education are the keys to freedom, and diversity enables one to live in a world with broader perspectives. This is Donna Sebo, and I will be your host for the next hour. Welcome to the Donna Sebo Show Special Editions. There's been so much in the area of medicine that is transformed into demonstrations we never would have expected. And we're going to be talking about regenerative medicine. Perhaps you've heard that term, and it's going to become a lot more common in the coming months as well as years. Medicine is being transformed in a phenomenal way. And in that transformation, it is affecting many different industries. Industries like sports and so many others like the beauty industry. Well, we have two very special guests that are going to be sharing with us information about stem cell therapy, which is a part of regenerative medicine. We have Dr. von Schwarz and we have Dr. Nordquist. Now, Dr. von Schwarz, I believe that you are in Southern California. Are you in Beverly Hills, Culver City? Where are you located?
I'm in Los Angeles today. Yes.
You're in the Los Angeles area. Well, I'm so delighted. I know your schedule is a hectic one, and I know that you're very, very busy. So I so appreciate your time today because I have your book on stem cell therapy, but it's titled The Secret World of Stem Cell Therapy. And I interviewed you last August on my daily radio show. And I'm so thrilled that we're able to be visual and have this opportunity to connect. And Dr. Nordquist, I just became acquainted with you recently.
Yes.
And I became acquainted with you because you're involved not only with sports medicine, chiropractic environments, but also regenerative medicine. So both of you gentlemen are involved professionally in arenas that have dramatically changed in, I'd say, just even the last 5 years. Dr. von Schwarz, your background is amazing. You have been engaged in medicine for so many years. In fact, you came from a family lineage of, 20 generations of doctors in your family history?
Yes, actually, that's right, yeah. You remember that, Donna? I'm impressed.
Yes, I remember that, very, very much so. But when you come from a family of physicians, sometimes it's a challenge to be able to determine what it is that you are going to want to be committed to. What made you recognize that you wanted to be in medicine, and you're a specialist in cardiology, but you've expanded your perspectives relative to medicine dramatically? Give us a little bit of your background for my audience.
Thanks. First of all, it's great to see you or hear you, Donna. I mean, last time we spoke on the radio. It's good to see you. Thanks for having me.
My pleasure.
Well, I never made a decision to go in medicine. It was my grandmother who did that. She decided that actually my sister was supposed to become a physician and I was supposed to become a lawyer. It went the other way around. My sister is a judge in Germany, and then I went into medicine. And I was always fascinated by the heart, and not only, but also because in the last practical term in medical school, I was exposed to a very famous German professor of medicine, and he was wearing a golden stethoscope. And I always said, I want that golden stethoscope. So then I have to become a cardiologist to get it.
All right, so you got the golden stethoscope, and that is quite an accomplishment. But you fascinated me with your book, The Secret World of Stem Cell Therapy, because one of the points that you brought out is that being educated in Europe, being educated in that environment, it was much different than what you found the American environment was when you started going into conferences, etc. Tell us what it was that enabled you to expand your perspectives relative to the shifts and changes with medicine, and how did you get into stem cell therapy?
Well, I mean, there is some differences between the educational system as well as practical medicine between Western Europe, at least in the United States. I think the quality in the United States is, of course, top of the line, but it is similar in Western Europe. The biggest difference I saw in medicine is that Americans are much more adherent to guideline recommendations purely for medical legal reasons because of so many lawsuits. Whereas in Europe, we were much freer to try different aspects of medicine, sometimes experimental aspects, if we thought patients might benefit. In the US, it's more restricted, so you have to do everything in the frame of clinical trials or preclinical trials. So I had the opportunity to work as a research fellow at USC, University of Southern California in Los Angeles. That's 18 years ago or so. We were among the first in the world using stem cells and embryonic cells in experimental animals, where we created, for example, heart attacks in rodents, and then we used the hearts of embryos of other rodents, took those out, isolated the stem cells, and then transplanted those stem cells and embryonic cells into the recipient rodents in which we created heart attacks weeks before. And we could show that after 4 months, those cells were still there. They didn't die off. They were alive, obviously. And that those cell transplantations resulted in improved cardiac function in those animals who had heart attacks compared to sham-operated animals. And that was a publication in 1989, I think, if I remember correctly, which started really the hype, the clinical hype on clinical stem cell therapy and studies for the cardiovascular sector. And then after that publication, tons of clinical studies were started. We were part of some of them. And every single clinical study, at least in the cardiovascular field at that time, showed benefits of stem cells. So we couldn't cure any disease, but we could improve organ function, in particular in the heart after heart attacks or in cardiomyopathy cases. We showed improved contractile strength of the heart after stem cell transplantation. And that was something unheard of, and there's no medication in the world which can do that. So that was the beginning of where we are now.
It is my understanding that stem cell research actually began back in the 1800s, which was a surprise to me. I was not aware of that. But we do stand on the shoulders of the people that have gone before us. We keep improving, and we keep exploring, and we keep looking at different environments. Now, Dr. Nordquist, you have been associated with the chiropractic arena, but you also are very much interested in regenerative medicine because you've been associated with the National Football League, the NFL. And how did that come about? And what got you started into looking into the various aspects of what we would call the healthcare benefit to people? What started you on that?
You know, I've been a chiropractor for almost 20 years, and I've felt what our limitations are. We're able to help certain situations and conditions up to a certain point. And one of my beliefs is that I want people to heal individually, personally. I want them to avoid unnecessary surgeries, unnecessary drugs, the opioid crisis. And I have a colleague who has been working with the NFL alumni for about 20 years. And 3 years ago, I was in contact with him, speaking of just expanding my practice, how I can help more people. And we talked about bringing in medical personnel. So we started bringing in nurse practitioners, and he suggested that I come in and start looking at stem cells. As I started doing that, he asked if I would be interested in working with him as working with the NFL alumni. So we are the only clinic in Washington State that is currently doing that. And it has now given our office the ability to take patients of ours that don't want surgeries, who don't want to be on drugs, and give them an opportunity to live the life that they want to live.
To me, the stem cell situation is so dramatic because it It encompasses so many different points. It is something that can be used relative to what you're doing, chiropractic, enabling the internal workings between the vertebra, for example, to be reconstituted. And there's, all aspects of the human physiology, which are so complex. And I recall, I don't remember how many years ago it was, people using stem cells from other individuals, and then they were finding a negative kind of a response. Well, why? Because they were foreign stem cells to the body, and it didn't work well. Well, then all of a sudden, and I say all of a sudden because I was made aware of it, then there's this tiny bit of liposuction that can be done from fat tissues, from bone marrow, from the different parts of the body that can rejuvenate cells. And we have them, and there were people that said, no, after a certain age, you can't do this. And Dr. von Schwarz, you're finding in your research, in fact, I know you've got a new book coming out, but you're finding in your research that we've just barely scratched the surface on the potentialities of using stem cells. Am I correct?
Absolutely, Donna. Yeah. I mean, we use more not autologous, but allogenic stem cells nowadays, meaning not from the patient himself or herself. Because as you said, as we age, we lose quantity and quality of our own stem cells. We still have stem cells in our bone marrow and in our adipose tissue, but we have shifted from using the patient's own stem cells to using donor stem cells, which usually come from umbilical cord blood, from placenta tissue, from what is called Wharton's jelly, because those are the cells which are able to create an entire human organism. So these are the strongest cells and the closest to embryonic. Of course, we don't use embryonic cells. That's ethically, of course, very questionable, and I'm completely against it. But these are what we call pluripotent cells, and they are extremely potent with regard to the ability to develop potentially in different tissues depending on the environment. And the immunogenicity, meaning the fear of creating like an immune response in the host, is actually minimal. Years ago, for example, we poked the membrane of those cells in order to reduce their antigenicity, meaning their ability to develop or create antibodies in the recipient. But nowadays we use something which we call secretomes or exosomes, which miss the membrane of the cells, and their risk of creating an immune response or even cancer, which was another big concern, is so little that there is really no clinical relevance to that as far as we know. But as you mentioned, of course, we need more large-scale clinical controlled studies to prove those early concepts.
Dr. Nordquist, you brought in some samples of vertebrae. So how is it that the stem cell therapy, let's face it, football players, they get jammed, rammed, punched, stomped all the time, and it's known that there are such serious injuries. And with you and your associate at your clinic, you do work, but how do you know where to put the stem cells when it comes to working with someone that has serious back injuries?
Well, I've actually brought knees.
Oh, those are knees. I'm sorry.
These are knees. Okay. That's okay. And the reason we like knees is that knees are a fully encapsulated joint.
Okay.
So when we put the stem cell in, it can't go to other parts of the body. And we'll do examinations, we'll do x-rays, we'll take MRIs, and we'll determine exactly what is damaged in the person, if it's cartilage, if it's the muscle, if it's a ligament. And as the doctor was saying, the exosome, which we also use, they're allografts, and there's no detrimental aspects to this. That exosome will go to the damaged area, if it's the cartilage, and that exosome will call in the stem cells, and they will actually tell them what they are going to be. These pluripotent cells, They are just a little cell that can become anything. It isn't predetermined if it's going to be a heart cell, if it's going to be a ligament, skin. So it has the ability to become whatever is damaged in the body.
Amazing.
So we determine exactly what is damaged. We localize it. We use either, in our office, we'll use an ultrasound, and the ultrasound guided will actually watch the needle go in and insert the stem cells there.
That kind of precision is fascinating to me. It really is very fascinating. But that's part and parcel of what is happening with technology. Technology is growing, and the sophistication and the precision with which it can be done, I think, is incredible. I understand that there's also an application of using stem cells, and Dr. von Schwarz, perhaps you can talk about this. You have found research where people that have had brain trauma, which is a very big subject for a lot of people in sports. And there's so many applications for this. The average physician would have a very, very difficult time keeping up to date with it. What would you say, Dr. von Schwarz, that could be encouraged for people in the medical field? Because almost everyone I've ever known as a physician wants exactly what you, Dr. Nordquist, said, and that is they want their patients to get well. They want them to be able to have a quality of life. They just don't want to hand them a pill. They want to really know what to do. And in the US, in our medical system, one of the biggest challenges we have is having the time with a physician, where a physician gets to know the patient so that they can say, all right, let's look at some options. The area of specialty has become so significant that really a patient often just feels like they're lost. They just don't know who they should talk to, what they should do. And that's why your book, The Secret World of Stem Cell Therapy, I think is great for the layperson as well as for medical professionals. Dr. von Schwarz, when it comes to dealing with patients, and you primarily deal as a cardiologist, but you've expanded your thinking in so many ways in dealing with different modalities. And you, Dr. Nordquist, you have done the same thing. You expanded your world and your thinking. Both of you seem to have a very good association and link with a university in Florida. Is this one of the key places in the United States that is really working with research and development? Dr. von Schwarz, would you like to respond to that?
Well, yes, thank you. First of all, I remind, and I'm sure Dr. Nordquist does the same thing, to tell my patients always at the first meeting ever that there is no FDA approval for stem cell therapy in this country, with one exception, which is stem cell transplantation for certain forms of blood cancer, but that's a complete different ballgame. So the regenerative therapy we are using is not FDA approved and is not covered by any insurance companies, and it's not widely recommended, mainly because of lack of large-scale clinical trial data. On the other hand, as I mentioned earlier, every single study which ever has been published, from hair loss to treating dementia to treating strokes or heart attacks using stem cells or stem cell-derived products, has shown some benefits. So we have expanded, as you mentioned, into, in particular, one area which we call neurodegenerative diseases. So we have a lot of patients with multiple sclerosis, with Parkinson's, with ALS, with dementia, after strokes. And we have seen, and that's still anecdotal somewhat, even though we are, of course, collecting the data and writing them up, immense improvements in mobility, in ability to think and move around, and there's no cure. So stem cells have not cured anyone in regenerative therapy from any chronic diseases. But it appears that in many conditions, we can at least create like a halt of the progression of the disease and an improvement of symptoms. And I'm sure Dr. Nordquist can say the same thing. If he injects exosomes into the joints. People, because of the anti-inflammatory effects, have significant improvement of symptoms, and that's what counts.
Dr. Nordquist, would you share with us one of the people or a story about one of your cases relative to a back situation and or a knee situation? Because you made a very clear point about how important it is to determine where the damage is, no guessing, so that that injection of the stem cells can go right to where it's supposed to go. Tell us about somebody that you have worked with.
Well, it's a little bit closer to home, but it's probably one of my favorite stories. We were planning on going to Hawaii for my stepfather's 80th birthday. And he came into my office, and I didn't realize how bad he was. And he was having trouble even walking up and down the halls. And we put braces on him. We did everything we could, and nothing seemed to help. And we went through the process of examination, x-rays, and he had both of his knees had exosomes and stem cell inserted. And within 1 week, due to the anti-inflammatory of the exosome, we were on a beach in Maui. He was walking on the sand, and that's about 2 years later. He still says his knees are 100%.
See, that is incredible to me, to be able to take an active component of a cell, to insert it into a spot of injury, and to see the result that quickly. To me, that shows how efficient the human body is, and how the human body is willing to do whatever's necessary to be able to recuperate itself and to find this venue that allows us, not just with the knees, but with the back, with just the organ development. This is something I remember in the early 2000s. There was a television program called Beyond 2000 that was on, and it was one of my favorites, and it showed how they were working back then on developing organs, the liver, the kidney, etc. Now we know the liver can reproduce itself. The kidney is a different thing. And we have people, and I'll just use the kidneys as an example. I've got some friends that are on dialysis. So to be able to understand how to take something that is that's alive, a cell, that has the intelligence, and I use that word deliberately, that says, I will adapt to wherever I am put. That to me is amazing. Absolutely incredible.
Absolutely. And if I may, the speed that these develop, and Dr. Schwarz, you can attest to this. I'm not a researcher, but from my understanding is one cell will turn into 1 billion cells within 1 month.
A billion
cells. And this will go on, from my understanding, for about 6 months. So that one cell will turn into 1 billion within a month, then 1 billion the second month, and go on and on and on. And that's how they're able to reproduce and regenerate.
That's incredible to me. I know of a man who had been a bodybuilder, and he was actually a guest on my show. And this is something that he did. He went into a facility, this was in Florida. He went into a facility, had a stem cell treatment on his knees, and he said then he had to go back in for a booster shot. I think it was 2 years later, and he's not had one since.
Yep.
I mean, this is something, we are in a whole different cycle where the Western environment, and gentlemen, feel free to correct me, I'm one of these lay people out here, this is my attitude, but so often when you talk about medicine, it's about symptoms. It's not getting to the root core of what is happening. Well, we human beings are rather complicated physiologically. You have your nerves, you have your tendons, you have your different types of muscles, you've got your lungs, your heart, you've got the brain, you've got it's just amazing to me. The human body is incredible. And to be able to find at this time that we are able to make a difference with people. Dr. von Schwarz, how is it happening with organ development? I mean, this is something, we have people that are waiting for transplants for every major organ in the body. We have major problems that are encountered with these transplants. How do you see the stem cell situation making a difference where people can actually have a quality of life?
Well, thanks for bringing that up, Donna. So I'm actually a heart transplant cardiologist, so I'm dealing with heart transplants all day long. So just to give you the number, there's more than 6 million people in the United States, 6.5 million actually, with congestive heart failure. And there's only 2,200 heart transplants done per year. So, I mean, that shows you, of course, there's a lack of organs, and not everybody is a candidate for heart transplantation. There's age limits, there's multimorbidity limits, and so on. So, what is left is just medical therapy, and often those patients end up in hospitals over and over again. So, besides what we said so far, we know that as transplants, besides the stem cells, besides the anti-inflammatory effects, and angiogenesis, meaning the creation of new blood vessels to improve perfusion circulation in the diseased organs, there is, at least to some degree, regenerative effects, meaning the ability of stem cells to rebuild damaged organs. And then we come to the next big thing, which is really anti-aging. And I personally don't like that term because it has been considered non-scientific, but it is actually very scientific because we have shown in several studies there is even such a thing as reverse aging. We can reverse some aging processes in the heart. We can reverse some aging processes in blood vessels, in the skin, and you can see it. I mean, I'm in the midst of Los Angeles, Hollywood. I mean, what do you think? All those people who look great on the red carpet, I mean, they come to us oftentimes because they get stem cell injections, even in the face. It rejuvenates your superficial skin layers. It rejuvenates your collagen production. And it's not only the looks, it is really a reverse in part of aging processes. And that's where we are going, not only for the heart or the brain, but for every single organ. And there is major efforts now in the academic world really to quantify how we can measure anti-aging and reverse aging using stem cells. And that's the future.
Amazing. And of course, Hollywood's always going to be on the forefront, you know, of wanting to have the best, and you want to look your best all the time. But it's exciting to me. Now, I wanted to share with both of you. I have two friends, and they're outside of the state of Washington, and they just got back from Panama. And they went to Panama for stem cell treatment. And this is with an organization there. It's highly reputable. I mean, my friend, she could have made a wonderful private detective. She digs everything up. And she did research for actually a couple of years to find out where she could go, what she could do, because she's had back surgeries. She has gone through so much pain. She's having situations, though, with her heart, etc. She had to go through a very, very in-depth examination. They wanted all of her background records. They wanted to know whatever medication she was on, etc. So what I am finding, and Dr. von Schwarz and Dr. Nordquist, I'm sure you do this too, you have to have an understanding of what a person's background is, as well as what they're going through right now, so that you can be able to really make some good assessments. And like you said, you've got the ultrasound, and there's so many ways of examining things. With what is occurring in the sports industry, this is huge. Brain trauma has become more and more in the forefront. Very seldom do any of these athletes that are performing in the higher levels, even with kids, for heaven's sakes, they have injuries too. But with these adults, and these usually are pretty large people, the sport arena of football is so intense, and there's so much damage it's done to their body. It's only been in the past few years that publicly it has come out how serious that damage is, and how, as they get older, it just compounds. So being aware of stem cell therapy. Dr. Nordquist, what is the average age of the patient that you typically find wants to come into you for stem cell treatment?
Our age group ranges. Either we're dealing with the retirees who have worked a long, hard life and who are just about to enter into retirement, and they can't do their everyday activities. They can't play with their grandkids. They can't go shopping. They can't stand. They can't cook, so they can't enjoy their lives. So with that, we're seeing, patients in their 70s, but then we're also seeing lots of younger people, athletic people in their 30s, in their 40s, who have had some sort of an injury and just haven't recovered properly.
Dr. von Schwarz, what is the average age of the patients that you see? I'm sure that it's not on, like Dr. Nordquist, it covers quite a wide spectrum.
I would say it's the same. I mean, I just treated a 30-year-old soldier with MS, for example. But the majority are people with chronic degenerative diseases, in particular heart and vascular diseases. On the other hand, we published 1.5 years ago a paper, for example, to treat patients with men with erectile dysfunction. That was the largest ever conducted study in the world with amazing results. So, and even in that area, the age range is between 18 and 90 years.
Amazing, amazing. Now, we basically, when we're talking about this, there's been an emphasis on men. My question is there a difference in dealing with the female physiology relative to stem cells versus the male? Is there a difference? Dr. Nordquist.
No, absolutely not. I mean, with what we do is we're focusing more on the joints. And a joint is a joint. It just depends on how it's damaged and how it needs to be repaired. And it doesn't matter if they're man, woman, young, old.
Well, I would expect tennis players and so many other people in sports would want to
tennis elbow, TMJ, shoulders, knees, hips. If you've got a joint and it's got damage, I mean, you're a candidate.
My goodness. Dr. Schwarz, von Schwarz, do you see a difference between men and women and the response to stem cells?
No, I agree completely with Jon here. There's no difference at all. I mean, we treat women with infertility with stem cells even. I personally don't do that, but we're involved with groups who do that. There was a group who injected stem cells directly in the ovaries with some early promising results, but it's too early really to make statistical analysis out of that. We just need more data. But no, I don't see any gender difference. The response is similar between men and women.
In the international community, I mean, both of you men are extremely busy. Dr. von Schwarz, you deal in research quite a bit as well as working actively with patients. Dr. Nordquist, you're very busy with so many people that come to you, the NFL, et cetera. So when do you have time to keep up on the latest developments with this? I mean, how do you do it? If someone is watching this show and they say, I want to know more about this, this is really intriguing to me. Now, it's not a magic bullet. This isn't something that's going to work for everybody in every way imaginable, because every single human being is different in their physiological structure and the way that their body is going to work. How do you keep up with the research? Dr. Nordquist.
So we're fortunate. The facility that we work with in Florida, they are actually FDA monitored. So as Dr. von Schwarz said, it's not approved, but it's monitored. And they take great pride in making sure that the product is as good as can be. So if there's ever a change, if the FDA ever wants them to make any modifications, they make the modifications and they tell us. So I'm not doing the research, but they definitely are there and they let us know. I'm on the phone or texting with them every week, actually twice today.
My goodness. Dr. von Schwarz, you have a section in your book on the FDA, and you wanted people to understand why it is so important to know about the processes and what they do. And we've just come through recently a real difficult time with COVID. And so many people went through so many challenges. And Now, finally, we are out of it and we're able to move forward. What has been the pros and the cons with the FDA relative to the stem cell research itself, Dr. von Schwarz?
Well, the job of the FDA is, of course, to protect all of us, the consumers. And protection means to watch and monitor closely even new therapeutic mechanisms or approaches. And you don't want anyone exposed to something which could harm the patient later on. So the FDA has, of course, a very important role. And there's certain requirements, of course, mainly based on large-scale clinical trials. You have to show statistically improvements and benefits outweighing risks of whatever therapies, whether it's a new drug, a new device, stem cell, whatever. So the issue is that in the stem cell world, there is no industrial lobby, because the vast majority of medications, of drugs, for example, provided, manufactured by the pharmaceutical industry, which were FDA approved, are based on studies sponsored by the pharmaceutical industry. So there is no pharmaceutical industry which sponsors stem cells, or hardly any, because there's not much money to make out of that. And if you want to do large-scale studies, starting from basic research, then animal studies, cell cultures, animal and clinical studies, I mean, that's $100 million to spend for one single indication at least. And that's just, there's no support. There's hardly financial support. And that makes it so difficult. We don't have enough data. And even though a lot of people, a lot of physicians and providers offer stem cell therapies, many of them don't do it in a systematic academic trial fashion, not saying they're doing a bad job, just the opposite. They're doing a great job in helping their patients. But we just, at this point, we need more controlled data to really go to the FDA and show them, look here, we have enough data. When we did a COVID study, for example, when COVID started, very small, single center, small number pilot phase study. And that study was, of course, not designed to look at mortality. However, even in a small number of patients, there was a significant mortality benefit in patients who received one single stem cell injections compared to the standard therapy. But it's not enough for the FDA to say, okay, we have enough data. No, we need more and more. And that's legitimate, of course, but we just need to encourage our colleagues in medicine really to collect their data, to get pre and post treatment data, little things like in the joints, the mobility, or symptom management after stem cell therapy. And it needs to be scientifically analyzed and published so that we hopefully can get FDA approval in the near future.
I wanted to ask a question also about pharmaceuticals. Do these have an effect on the stem cells? Because you're putting the stem cells into the body. If a person is taking a lot of medicines, do you have to take that into consideration, or does it make any difference? Dr. Nordquist.
You know what, I'd have to pass that off to the medical professionals in my office. They deal with all the medications. That's outside of my arena. I'm strictly on the joints, but Dr. von Schwarz, I'm sure you are well aware of this, and you could answer that.
Yeah, I mean, there are certain drugs we know they interfere really with the ability to stem cells to act and to stimulate the stem cells in the patient's body. The typical example is steroids and NSAIDs, which are non-steroidal antiphlogistic or anti-inflammatory drugs like ibuprofen, diclofenac, and so on. So we advise our patients after a stem cell injection, whether it's in a joint or in the system or in the spine, whatever, to avoid taking steroids or NSAIDs, at least for several days after injection, because we have seen reduced efficacy if patients were constantly on NSAIDs. The other thing is, and I remember one case years ago where a patient didn't tell us he was a cocaine addict, and cocaine definitely kills all the cells. So if you get stem cells, don't take cocaine. That's bad.
There you go. Now that presents an aspect of chemistry, and when we get down to the basics of all this, it is chemistry, isn't it? It is dealing with facts of living cells and how are they going to react within the environments that they're going to be introduced to. Now, you work, Dr. Nordquist, very strongly with the University in Florida. And Dr. von Schwarz, where do you work also with the University in Florida? What are the environments that you find that you are able to interact with in dealing with people and their individual situations? Do you have more than one facility that you work with?
Yeah, well, I was I was involved in clinical studies at Cedars-Sinai Medical Center in Los Angeles years ago, but now we are doing everything on our own. We have an anti-aging or reverse aging regenerative institute in Los Angeles. We have 3 clinics in the larger Los Angeles, Riverside, San Diego area for cardiology, but also for anti-aging and regenerative medicine purposes. So we get our own IRBs, we have our own research team, and we'll stay on top of that. We do everything by the book, so nothing outside IRB-approved studies at the current time. We use the same products. I'm approached every week by some labs who want to sell me their products. I'm very reluctant because I have seen over the years horrible quality, and I'm sure Jon can say the same thing from his experience, where people don't follow the screenings. I'm a member of the International Society for Stem Cell Research, which has published recommendation guidelines in 2016 and then revised last in 2021, how stem cells should be prepared, the hygienic measures, for example. And unfortunately, many labs don't follow those recommendations. And then you have cases like a few years ago where 18, 19 patients in the US ended up with septicemia, sepsis infections, because the products they bought from a California-based lab were contaminated with E. coli, with bacteria from the feces. And that could lead to life-threatening infections. And similarly, I'm very reluctant if people ask me about, you mentioned Panama. I went to several places abroad, and usually the doctors have been well-trained, they have beautiful institutions. But the biggest issue, I think, for us is that there is no quality control. We cannot really look into the quality control measures. So we are very reluctant to recommend our patients to go abroad until we have more universal guidelines and recommendations and people follow them, which we just don't know.
Quality control. Now that is something that usually the pharmaceutical industry is held accountable for big time. And when we get pharmaceutical products from India and from China, et cetera, there is always that challenge. What are their protocols? Are they following the protocols that we set? And with the FDA, it was my understanding that it's very difficult for them to be able to do the quality control like they do in the US typically outside of the country, that is really, really a challenge. So I am familiar with what you have just mentioned. Dr. Nordquist, when you are contacted by someone and someone is interested in having the stem cell treatment, tell us what your protocols are. What happens when someone calls out and says, gee, I've had a back injury or I've got a problem with my knees? What is it that a person can expect? What do you make them aware of so that they can be educated before they actually have the treatment?
You know, you're speaking before about how medical professionals don't have the time. So in our office, patient comes in, does their paperwork, we do a full examination, and the examination isn't rushed. It's an hour-long time commitment so that we have time to figure out exactly what their health history is, what their medication history is. We do not just the medical exam, we do a chiropractic exam. We determine their joints, the functionality. We do x-rays. We see if they've got MRIs, any medical information that we need from them. After that point, myself and nurse practitioner get together, discuss the case, and decide if they are a candidate. And we make sure that it is going to be a positive result. We don't just assume somebody's going to do well. We don't hope somebody is going to do well. This is a new arena. We're in a small location. We want everyone to do well, and we make sure there's going to be a positive outcome.
Dr. von Schwarz, what are the protocols when someone comes in to see you, and what do you recommend people to pay attention to, whether they see you in the future or not? What do you want the public to know? I know you covered in your book.
I think the most important, and that's, as you know, part of the book also, don't ask or don't believe Dr. Google. He is not the smartest. So, I mean, if you look on the internet, if you type in, let's say, stem cell therapy and heart disease, you get within 0.1 seconds like 55 million hits, and 99% of those is pure advertising. There's no scientific data, or hardly any scientific data. So it's very difficult for a potential patient and consumer to really figure out what are really the facts, what do I need to know? That's why I actually wrote the book. Because you're lured into reading advertising and marketing materials rather than any scientific clinical reputative data. So I have a lot of patients asking for stem cell therapies, and I think on average I probably deny more than we accept, because like Jon said, we want patients to feel better, and for example, for certain conditions like advanced cancers, I don't think there is a role of stem cell therapy at the current time, and I'm not an oncologist, and I would stay away from treating those patients. Even though I know many of my colleagues do it for whatever financial reasons, they should know that there's no improved outcomes as far as we know at this point. So it has to be reasonable, and patients have to have the understanding that, again, as I said earlier, there is no cure of any diseases so far using stem cells. There's improvement of symptoms, in particular in chronic degenerative or inflammatory conditions, whether it's a arthritis in the knee, or whether it's a lupus flare, or whether it's microangiopathy in diabetic patients. We can improve that, but we can't heal it. And so we want to make sure, and like Jon said, we take time to explain to the patient that we can improve symptoms but can't cure a disease, and that stem cell therapy is still not FDA approved, and it's considered experimental. And if patients understand that, of course, they're often willing to give it a try, and with amazing results. And in my opinion, it is the future of medicine, no doubt about it.
One of the things that I wanted to ask you about was, is there an international organization that works with all countries relative to stem cell research? If someone wanted to find access to the different papers. Now, I know the University of Florida, they provide those to you when you go, but Dr. Nordquist, is there an international group and or a national group here in the United States where people could say, all right, let me see if I can find out about the papers that are published and who's doing what? Then is there one that you're aware of?
Nothing that I'm aware of, not a regulatory branch or a group that is formulating any sort of research in culmination. But Doctor, you might know more. That's more your realm.
Well, there's the International Society for Stem Cell Research. As I mentioned earlier, I'm a member of that organization, but they are not collecting new data. They are a body basically which formulates guideline recommendations how to conduct stem cell research. Other than that, there is no body which gives you information. So what I recommend usually is, before going to any physician or to any provider who offers stem cells, just look them up, do a PubMed search, for example, see what have they published, have they shown their data at any national, international conferences. And again, don't rely on marketing materials, but really on scientific data.
And that is something for the average person. It's going to be very difficult for them because most people, I mean, I interview hundreds of people a year. What I do is very unique. Very few people do that. And I'm exposed to different varieties of information. Most people are so busy just with their home and their families and working and taking care of everyday life that this is something that for them, when they will hear about stem cells, they'll say, wow, but I know of someone that, my goodness, she has suffered so much with stem cell therapies that cost her thousands and thousands of dollars, no exaggeration here, and she is still in the same condition she was in before. And it is something, as we've already said, it's not a magic bullet, it's not for everyone. But perhaps the people that are offering that really aren't doing it correctly. I mean, you just don't know. How do you know? And most of the prices that have been quoted to different people, and let's face it, money is a very significant thing. The average person may say, I would never be able to afford it. So we're looking at something that is going to evolve, I would estimate, over the next 5 to 10 years, where it is going to be more readily available in the medical community. How do you feel about that, Dr. Nordquist?
You know, I think you can't put a price tag on living your life. You can't put a price tag on playing with grandkids, playing with a dog, walking on a beach. And the price, I mean, it's a tenth the price of a knee surgery. It's minimal when you're talking about side effects, when you're talking about sepsis, when you're talking about amputations and even death on a surgery. So I think people get money hungry. They look too much into the costs and not the benefits of it. And the costs they're only going to go up if the FDA gets involved. When we said $100 million for studies. So it's a slippery slope on whether the FDA is going to approve, because that's going to cause increased prices. The monitoring that they do makes sure that there's a good product. And I think you're going to have to determine how much is it worth to you.
Dr. von Schwarz.
Yeah, I completely agree with Jon. So on one hand, of course, I mean, quality costs money. I want to say that. So number one is, nobody really needs to leave the US to get highest quality stem cell therapy, whether it's for the knees or for the heart or the brain or for anything else. Number two, I mean, we still need studies, large studies. And in order to conduct them, we really need philanthropic support. We need sponsors who are willing to put millions of dollars in. For example, I was approached not long ago on the question of, can stem cells help with autism in children? And if you look into that in the literature, there's a few smaller studies from China, from Germany, from other places, Poland recently, which shows potential benefits, but nobody has really conducted a large-scale study. If I'm ready to do something like this, but I would need like $10 million to do that, you know. So we have never done any fundraisers, but I think in the very near future we are dependent on really philanthropic support to conduct those studies, which oftentimes you cannot do in the large academic institutions because they're very regulated and regulated. But we can do it in our private institutions if we have the financial support.
Well, gentlemen, this has been quite a conversation, and I like to think that the people that are going to see this video are going to be aware that they have some options for better health that they did not know was available to them, and that there is a way of being able to enjoy a quality of life regardless of your age. And this is something that I so appreciate, both of you, Dr. Jon Nordquist and Professor von Schwarz. It's been a delight having you. And for those of you that are viewing this program, I want you to know the contact information for both of these gentlemen will be in the aftermath of this conversation, and you will be able to see that information available to you. Also, the audio portion of this program will be featured on my daily radio show, The Donna Sebo Show, and you can go to my network page and you can find out when that is going to be coming up. I so appreciate you, gentlemen. Thank you for being my guests today.
Thank you very much.
Thank you very much for having us.
You have been listening to the Donna Sebo Show Special Editions. The audio version of this program will also be heard on the Donna Sebo Show radio broadcast. We are delighted you were able to join us and invite you to share this programming with your friends and family. Have a rich and fulfilling life.